Hey, Dental Nachos, it's Paul, Dr. Nacho. One of the things I love to do is bring the Dental Nachos community good ideas, stuff that they can do better in their practices, whether it's clinical, whether it's business, practice management, to make your day go better. And I'm so happy to have one of our key resources and sponsors and extraction legend, Dr. Karl Koerner, and his Dr. Jordan here with us here today. We're going to talk with you guys about what you guys do, how you help dentists, what you teach. So welcome to Dental Nachos, the Dental Nachos group, and tell us a little bit about yourselves.
Hey, Paul, thanks so much. We're glad to be here. This is my friend Jordan Davis. We live near each other, and we've taught courses together before. He's a great guy. He's had a lot of surgery experience. He's not an oral surgeon, but he spent a year doing exodontia. So, I mean, that's, for a general dentist, that's awesome. He does a lot.
That's awesome. Now, before Jordan, I call myself a medium-age dentist, a MAD. I've been in dentistry for 17 years. How long have you been a dentist? I think you told me before. Are you 8 years?
It's close to 8 years.
8 years. So you are a CAD, a child age dentist, just in case you wanted to know. You're gonna be mad like me soon. But as you introduce yourself and tell us about yourself, also just share why general dentists why it makes sense for them to learn more about extractions, do some, refer some, and a little bit about your journey.
You're asking me?
Yeah.
So just a little bit about myself. So after dental school, I went to the Ohio State University, and I was in the oral surgery program there for a year. And so I did a lot of oral surgery extractions and things like that.
Nice.
But why do GPs need more education in this? Well, the reality is, at least in more recent years, they're not getting much oral surgery in dental school. Yeah. And so they don't have much experience coming out. And then there's not a lot of CE out there for extractions. You know, you got tons of CE for dental implants. And of course, all these GPs want to do dental implants, but, we believe that you want to build a foundation in surgery first if you want to be good at dental implants.
I totally agree. One of the things is I had the pleasure of doing my favorite thing on earth with Karl. That's eat food in Philadelphia. So we got to eat food, and I taught implant courses for years. You're so right. So if you're listening, Dental Nachos audience, one of the take-home nachos is to just build a base of removing teeth, extraction, socket preservation. One of the reasons I'm such a big proponent of GPRs and AGDs is because extractions, and we're gonna talk about what you guys offer, extractions are a challenging thing. I always say this: you could be working with other dentists in your practice, but if they don't know how to do something, they might cheer you on, but they can't help, So I don't do any endo. So if one of my associates was doing endo and said, I can't find this canal, I'd say, sounds pretty tough, and I would not be able to help. So extractions are sometimes where you need the ability to troubleshoot. So tell us a little bit about how you guys train dentists, and I love that you have this continuum. Let's say I'm a general dentist in Dental Nachos. I want to learn more about extractions. Walk me through what you guys do from hands-on with models, lecture, and live patient surgery.
So we have a lot of different levels. The first level is a kind of an introductory course, and that course is just one day. There's no hands-on, but it gets into the basics. It's a really good review of what you need to know when you're doing surgery.
Gotcha.
Which cases are for you, which cases aren't for you, which instruments are best. Most of all, too, it's getting it done in the time allotted. There's nothing worse than scheduling a half hour, and then you got your receptionist standing in the doorway with her arms folded.
Yes, exactly.
45 minutes going on to an hour now. So
I always say this, Karl. I say, if you roll your eyes any harder, you're going to sprain one of them. So, that's one of my things there. So I totally am with you. So the first level, which you guys are having where next? I know you give me some notes on.
It's going to be, really, we're going to do that every month somewhere in the United States. It's like a traveling show.
So I recommend Dental Nachos. I have a JFO, just find out, and my team will drop it in. Think about going to an introductory course with an open mind. One of the things, and I don't know, Jordan, we're between, I'm between you and Karl, is dental school, it just doesn't foster open-mindedness. I would say go to an introductory extraction course, not sure if you want to do it or not. Just seeing. Maybe you go thinking, no way I want to do this, and you think, you know what? I got a lot of older patients. I do dentures. I do this. It makes sense. you might go thinking, I want to do this, and it might not fit also into your practice workflow. So first is the introductory course. They're held monthly all over the country.
If somebody's interested in that, they can go online and see more about it. And if we don't have it up there, I'll make sure it is, just to see the objectives of that course and what they plan to get, what we plan for them to get out of going to it.
Nice.
Well, the next step would be a more advanced course, which they actually have to do 8 hours online before they even come to it and take a test. So that gets them mentally into it. But that 2 days that we spend together right after that is all hands-on. I mean, it's like 90% hands-on because we've already covered the didactic online. So they
I like that. I like the ability. I'm like a practice owner, a dad, a Dr. Nacho. So to be able to consume some of the stuff online at your own pace and rewatch it, I just think it's so valuable. I don't know if I mentioned this before, Jordan, but I saw Karl with my own dad years ago at the Great Internet Meeting, and they were live streaming extraction from Utah. And that's what I want to do now. And he's such a pioneer in doing that. But I just think that's so key. So basically you can exercise learning things online, and then you come hands-on. Now, Jordan, you're closer to the new dentist age. What do you think, someone's taken the introductory course, they come to the hands-on, the barriers for them implementing that into their office, you don't get a chance to do it on patients, and you guys have this opportunity. Tell me, Jordan, a little about your live patient courses and how they work.
Well, I think, the first thing I wanted to mention is that the Continuum is kind of a step-by-step process that makes sense, right? You're starting with gaining some knowledge, which you need to have before you do procedures,
right?
And learning some of it on your own, and then being able to go into doing models and pig jaws and being able to do some hands-on, so to get a feel for it. And then, like you said, the live patient courses are, they're so valuable because that's really, for a lot of dentists, that's kind of where they stop with a lot of CE, to be honest. They go to a course, they learn about it, they gain this knowledge, they're like, oh, this is so great, this is going to be amazing, I'm going to go to my practice. And then they go and they kind of freeze up maybe a little bit, or maybe they're just a little bit too timid, so they don't do it. So if they can actually get their hands in the patient's mouth and actually do these extractions with some supervision, it makes them start to feel a lot more comfortable to go back and do it in their.
Well, I was a big sports fan. I play a lot of sports. You create, and I do a live patient implant course for a starter course, and I've done it for years. And I want everyone to know, when you teach these courses, you should give your instructors a pat on the back, because it's difficult to teach someone else to do something on a patient. I love doing it, but it's just it's a challenge, but the outcome is so great because it's a real in-game situation where you're playing the game with your instructor at the same time and seeing, the troubleshooting. That's everything is troubleshooting. And I think what you said, Jordan, is exactly right. I coach practice owners, and you got to check hygiene, do stuff, and you come back from a CE course, and if you haven't really gotten any hands-on it, it's like, it's easy not to do that. Like, it's easy not to go to the gym, if you don't put it into your schedule. So I think what you guys do there. So where are the live patient courses held? Where, if I was a dentist, I said, I want to go to one of these live patient courses, where do you guys hold those?
Well, we have them in different places. In fact, one of the places is in Jordan's office.
Oh, nice. I like that.
We will bring people. The airport is like 12 minutes away. There's a hotel like 100 yards from your office.
Right there.
It's a nice one.
Yeah.
And then for 3 days, we'll pack in as many patients as we can for 3 days doing surgical extractions, one dentist assisting another dentist. So there will be 3 or 4 chairs at the most with 6 or 8. And we'll have 2 instructors. So it's kind of like a dental school in a way, where there's
great
helping get through it. So besides Utah, we have 2 places in Utah. We have one in New Jersey, and then we have one in the DR, and we're negotiating now for one in Honduras, but then we need a place to play, right? So we go to Roatan on the way home. So it's
nice. I like that. New Jersey, you guys can come down and have nachos. I was just in Utah with Mrs. Nacho. She loves that name, Jordan. I was just in Utah at Snowbird for a dental meeting with Dental Intelligence. So what I like to do for the dental community and the dental knowledge community is, keep up the momentum. So let's put, I'm somebody who wants to get started. We have the introductory courses held all over. Where's the net? And we have Ariel will drop in. You guys are kind enough as a sponsor to give us some Nacho TLC. I know my people, the dentist, you know them. They love a deal. They're really into a deal. They don't like when their patients ask for a deal though, Jordan, right? Very interesting. They don't like when the patient wants a deal, but they want the deal. So we will give them a deal. So you guys have kindly given our group a deal. Tell us about that.
Okay, so our first one day is in Orlando, and the next month it's in San Diego. So we're hitting both sides, and later we'll hit the middle. But we have those often, and those are $600 and something is all, and they get
nice.
a free state-of-the-art luxator for being there. So we're
nice.
And so they can come to any of those any month. And then the first one that we have of the 2-day, which is like the 8 hours, and then the 2-day with hands-on, is in Houston. And that will be later in January. One is on the 16th, the 1 day, and then the 24th and 25th are actually in Houston.
So I like that. And I want to just bring up a topic that I'm a big CE provider, and I love doing meetings. I also run multiple offices. This is just a public service announcement since a dentist. It's okay to move your hygiene patients. People will live. So we've gotten into booking 6-month hygiene. And I say to patients, I say to dentists, could you come to a course on February 10th? It's the secret to life and being happy. I can't. My hygienist is booked, right? So I say, think outside the box. Be creative. Some of those patients will cancel anyway. But I love that you're giving us at least some dates in advance. Because as a CE provider, and I say this half jokingly, because I know if I went into my office and said we all have to take off on December 20th, first thing I get was the rolled sprayed eyes. We got 2 columns of hygiene. So I love that. We'll put in the comments, and I'll put the dates for all this stuff. And Jordan, tell us a little bit about, in your practice, how is doing more extractions and surgery? Tell us about the impact on your patients, your team, and you as a dentist. I like to hear the queso, the good part about, I know it's profitable and it's a way to add profit, but also just how it makes you feel as a dentist and how it helps your patients.
Well, first of all, I have passion for surgery. I love doing it. So for me, I do it all the time, and it's just a part of my practice. Of course, I do pretty big surgery in my practice, but I think, obviously it's profitable. It's just fun. I really enjoy it. It's interesting. For people that haven't done a lot of surgery, they probably think of surgery as stressful. I don't want to get into that and have all that stress. Yeah. But honestly, for me, now that I have the experience that I have with it, I find surgery to almost be less stressful. I know that sounds crazy, but once you have that experience, it almost becomes less stressful than restorative treatment, because I do both in my office. And so for me, I just love it. Anytime we have surgery on the schedule, I'm happy. And I think
what I want to share about this wacky dental world as a general dentist is restorative work. It's never done, right? You can always work on it, tweak this, do this. Extractions, implants, it's done. Tooth is out, implant in, we're done. No one complains about the color. Nobody says that it hurts them. So I totally am with you. And I love training the beginning of implants, and dentists who get into it, whether they're doing 1 implant a month, 2 implants a month, 3 extractions, I think what you guys are doing and getting dentists to do this, train yourself in extraction so you can do more implants, because once you get to placing straightforward implant cases, they become super relaxing compared to restorative, because, they just have a beginning, middle, end, right? And I just think that we are trained as general dentists to constantly be tinkering and tweaking things. And I think I hear you. And I think, if you can learn about surgery in a responsible way from guys like you, it just can add an element to your practice that's so important. And from a practice management standpoint, and from some of the things I do, this is the work that's going to be needed, because we have 60 to 80-year-old patients, their teeth, they failed. But I don't say failed, very dramatic, right? Dentists are very negative. I just say it's time for their teeth to retire, right? Time for their teeth to retire. And these are patients who are, have, high dental IQ and they want teeth, but they're in their 70s. And, another thing that's good, they've had a bridge for 20 years. Why we say that failed, I don't know why. We should call it a good, because what else lasts 20 years? But, they have outlived this dental work. And now there's this whole, in our family, there's a lot of shark talk. We watch Finding Nemo, all this stuff. And, sharks have those extra set of teeth. I believe that us human beings, we're creating a human-made extra set of teeth with implant overdentures, and I just think that's cool. So I love your guys' message. Do you want to say something, Karl?
Yeah, I was just going to say, extractions have changed over the years. It used to be you're taking out the tooth, you're pulling the tooth. Now, if it doesn't come easily, we take the skinny burr, which is really thin, and go into the PDL around it. And nowadays, we literally cut it out if it gives us grief.
Yeah, you guys have come up with so many great techniques. So I love what you guys are doing. We're going to have more content here. My Dental Nachos world, I know you're sitting there thinking, this sounds good. I'll think about it. But I like to go from stop thinking to doing. So just do the next thing. Look into the introductory courses that Ariel's put in the comments. And one of the things, and this is just my message of all Dental Nachos, is just do some, right? You're training people to do some extractions. You don't have to go and do every extraction, nor would you want to. And I just love that mentality, whether it's endo, extractions, implants, because it brings us all together. You know, don't do none. I know that's not proper English. Just do some. You know, don't do none, just do some. So thanks, guys. Any parting words? If people want to reach out to you, what is the best way for them to connect with you guys?
One parting word is that when you get beyond the routine extractions and all that and the surgicals, we do have courses on impacted wisdom teeth as well. And that, once you get past this and are like at a little higher level, you'll be ready for that. We're ready to give it to you. And
awesome.
KSI.com, KoernerCenter.com. There's also another way to get to it, but the KoernerCenter.com is probably the best. Or hey, if they want to email me, I'm good with that too. And
awesome. I love that. Jordan, what's the best way to get in touch with you?
Karl R. Koerner at Comcast.net.
Awesome.
You can look me up on Instagram or Facebook, Dr. Jordan Davis. That's probably
nice. We'll follow you on Instagram. You know, we can. Is your stories all just teeth flying out of the mouth all day long, right? On Instagram?
No, not totally. It's more the end results. You'll see more.
Yeah, no, I
there.
like that. All right, awesome, guys. Stick around. We're gonna. I want to talk to you guys. We're gonna stay by to the Dental Nachos community. All right, Dental Nachos. Some hygienist was waiting to be checked, so go check her so she doesn't roll her eyes too hard. And think about getting started with extractions. It's a great thing to do, whether you're a new dentist, a bad baby age dentist, medium age dentist, or even a seasoned age dentist. Thanks for being on, guys.
Hey, thank you.